Welcome to our channel where your health is always our top priority. Today, we're going to delve into 6 unusual signs that could indicate liver damage, and no, it's not just excessive alcohol consumption that's to blame. A multitude of factors can lead to liver issues, from your diet, changes in your lifestyle, to having a fatty liver, among other causes. The worrisome truth is that most people only discover liver problems when the condition has become severe and requires significant medical intervention or surgery. To avoid finding yourself in such a predicament, being aware of the early signs and symptoms of liver damage is crucial. Stay tuned to find out what your liver might be trying to tell you. Diving into the realm of liver health, let's examine our first indicator, the yellowing of the skin and eyes, a condition medically termed jaundice. It may seem peculiar at first, but it's a critical signal that warrants your attention. Our liver tirelessly filters out a substance known as bilirubin, a byproduct of the body's regular breakdown of aged red blood cells, characterized by its yellow pigment. When the liver is compromised, it struggles to process bilirubin, causing an accumulation in our system, which then manifests as the distinctive yellow hue on the skin and in the whites of the eyes. Let's unpack this further. Under normal circumstances, the liver effectively processes bilirubin and disposes of it via bile. However, liver damage impedes this process, leading to an increase in bilirubin levels in the bloodstream, evident through the yellowing associated with jaundice. It is crucial to acknowledge that jaundice itself is not a disease, but a symptom signaling potential liver dysfunction. If you observe such changes in your skin or eye color, it's indicative of a liver that may be under distress, and obtaining medical consultation without delay is advisable. Detecting such symptoms early can profoundly influence the approach and success rate of treating liver-related health issues. Now, let's shift our focus to a symptom that's often brushed aside: unexplained fatigue. We've all been tired at one time or another, but the exhaustion associated with liver damage is in a league of its own. Consider the sensation of perpetual exhaustion and enduring need for rest regardless of ample sleep. This type of fatigue could be a telltale sign that your liver may not be up to par. To understand why, we need to delve into the liver's role in energy production. Our liver is the storage house for glycogen, a form of sugar that is converted into energy as our body demands. If the liver is impaired, this conversion process is disrupted, leading to a persistent state of fatigue. From a medical perspective, such fatigue is often tied to increased levels of liver enzymes in the blood, pointing to liver inflammation or damage, as well as a reduced capacity for protein synthesis, which is crucial for health and energy. If you're experiencing a level of tiredness that doesn't seem to recede with rest, it might be more than just a bad night's sleep. It could be a signal from your body that your liver health needs attention. This symptom should not be overlooked. Early intervention is vital for preserving your health. If this unrelenting fatigue sounds familiar, it's wise to seek a healthcare provider's insight to investigate the underlying causes. Advancing to our third unusual sign, persistent itchy skin. Occasional scratching is normal, but when the itch doesn't go away, it could be more than a simple case of dryness. The liver plays a pivotal role in our skin's well-being. A dysfunctional liver may lead to an excess of bile salts in our bloodstream, which in turn can cause persistent itching. To get into the specifics, bile salts are compounds produced by the liver that aid in digestion. However, when the liver is damaged, these salts can build up and migrate to the skin, resulting in a relentless itch. In medical terms, an increase in bile salts often points to liver issues. If you're experiencing an unusual amount of itching that doesn't seem to subside, it may be a subtle warning from your liver. Itchy skin, while often overlooked, can be a crucial indicator of an internal imbalance. consulting a healthcare professional is a prudent step to uncover the cause of your itchy skin and to check for any liver-related concerns. Addressing these signs early on is crucial for effective management and prevention of more serious health problems. Turning to our fourth unusual sign, let's talk about dark urine. It may feel odd to monitor the hue of your urine, but its color is actually a significant indicator of your liver's condition. Typically, urine should have a pale yellow shade. If it starts to appear consistently darker, this may be a warning that your liver is struggling. Dark urine often indicates a problem with the liver's processing of bilirubin. Think of it as a cautionary signal from within. While it's not necessarily a reason for immediate concern, it's an alert that shouldn't be ignored. Persistent dark urine warrants a conversation with a healthcare provider. A professional can carry out the necessary examinations to pinpoint the exact cause and preempt any liver-related problems from worsening. Keep in mind, catching any health issues early can be crucial for effective treatment and long-term well-being. Remember to subscribe to our channel to stay updated with our latest videos. Addressing our fifth distinctive sign, pale or clay-colored stools. It's not a subject that's typically discussed at the dinner table, but the appearance of your stools is a surprisingly telling indicator of liver health. Under normal conditions, a pigment called bilirubin, produced by the liver, imparts stools their characteristic brown color. When the liver is healthy, it processes bilirubin effectively, which in turn colors the stools. However, if there's a liver malfunction, it may not process bilirubin properly, and this is reflected in pale or clay-colored stools. Put simply, a lack of color in your stools may suggest a hiccup in this coloration process, a visual hint that your liver might not be functioning optimally. Medically, a lighter stool color corresponds with reduced bilirubin content, which could signal liver dysfunction. While discussing stool color might be somewhat uncomfortable, being observant of such changes is crucial for early detection of liver conditions. Should you notice a consistent presence of pale stools, it's wise to seek medical advice to investigate your liver's health. Prompt action can be a key factor in managing liver health and safeguarding your overall wellness. Discussing our sixth and final peculiar sign, bruising easily. Bruises are common, yet if you're experiencing more frequent bruising with little to no impact, it may point to an underlying issue with your liver health. Our liver is instrumental in producing proteins that are vital for blood clotting. If the liver is compromised, its ability to synthesize these proteins diminishes, thereby increasing your susceptibility to bruising. To put it in layman's terms, the proteins your liver produces act as the body's internal repair team, aiding in stopping bleeding and healing bruises. When liver function is impaired, this repair crew isn't as effective, which means bruises may appear more readily. From a clinical standpoint, a propensity for easy bruising is often related to a decrease in the liver's production of clotting factors. Therefore, if you're noticing bruises cropping out more often, particularly from minor or negligible trauma, it's a good idea to seek a medical evaluation. A healthcare provider can check your liver function and advise on next steps to manage and mitigate any issues. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy.